Okay, well, hello everyone again, and welcome to our presentation tonight. This is Dr. David, and I'm here with Dr. Murray, who will be doing the presentation in a few moments. Remember, this is not about healing or diagnosing disease. This is about primarily about your health and how your body functions, specifically how your liver and biliary system function. And so our hope is that as you better understand how your vital organs function, as you better understand how your mind functions, you will be able to make the right choices. You'll be able to ask your doctor the right questions. You will be able to take the right actions towards improving your health, because in the final analysis, you have a responsibility to take care of your own health. It's not the doctor's responsibility, it's your responsibility. I know some people don't like hearing that. And I'm going to hand this over to Dr. Murray. Dr. Murray, while I'm handing this over to you, I'm going to be reading your bio. So the screen is going to change to your screen, and you can just click on clean screen while you accept it. I want to go ahead and read Dr. Bio. Okay. Dr. Murray is the author and senior editor of Harper's Biochemistry. He is a biochemistry professor emeritus at the University of Toronto in Canada. He has done several presentations for us. We're very proud to have him on. It shows that we have been treating him well. That's why he keeps coming back. So we're glad to have him back. Dr. Murray was born in Scotland, and he received his medical degree from the University of Glasgow, Scotland. He interned at Victoria Hospital, London, Ontario, and then completed a further year of postgraduate graduate training at the University of Michigan, USA, where he was awarded a master's in physiology. This was followed by 3 more years of graduate research in biochemistry at the University of Toronto, Canada, culminating in him being awarded a PhD degree. Dr. Murray has had a distinguished teaching and research career at the university, during which he received faculty and alumni awards for teaching, and he has trained more than a dozen graduate students. He has published over 50 scientific peer-reviewed papers, authored multiple textbook articles, including various chapters in a number of textbooks, and has been the senior editor of the last 8 editions of Harper's Biochemistry. Dr. Murray has engaged in research on glycobiology, which is the study of how sugars affect the body. That's how I met him. And in various aspects of liver function. At present, his major interests are in how biochemistry and nutrition influence health and disease, and also in medical education. Dr. Murray, over to you, and thank you so much again for taking the time to do this.
Thank you, David, for that very gracious introduction. I'd like to thank David and Sherry for inviting me to talk tonight, and also thank all the listeners for joining us. I'm speaking from home just outside Toronto, Canada, and the topic tonight, as David said, is the liver and biliary system in health and disease. At various times in my career as a medical researcher and teacher, I have worked on a number of aspects of liver function. There are no commercial connections to this webinar. As the title suggests, it is basically for people who are interested in learning a little bit about the liver and biliary system in health and disease. And I like the quotation, is life worth living? It depends on the liver. So here are 2 quotations with somewhat different views about the liver. The first is by the surgeon Richard Seltzer. The liver, no wave of emotion sweeps it. It's not the brain. It doesn't have that type of sensation. Neither music nor mathematics gives it pause in its appointed tasks. And a somewhat more skeptical view is by the American Ambrose Bierce. Many of you may have heard his name. And he describes the liver as a large red organ thoughtfully provided by nature to be bilious with. It was at one time considered to be the seat of life, hence its name, liver, the thing we live with. So the objectives of this talk are to describe very briefly the normal anatomy and functions of the liver, gallbladder, and bile ducts. The gallbladder and bile ducts are often called the biliary system or biliary tract. Then to indicate briefly the major medical conditions that affect the liver and biliary system, we do not have time tonight to describe details of treatment, which would be inappropriate anyway, I think, on this webinar. At the end, I will list some simple measures to help keep your liver healthy. And as already David indicated, and I'd like to stress, if you have a problem with your liver or biliary system, see your healthcare provider immediately. Do not rely on this webinar, which is for general information only. So this just indicates it's a pretty crude drawing by myself here of where the liver is. It's mainly in the upper right side of the abdomen. It's a pretty large organ, as you can see. This is where the lungs are, heart here, and it occupies mainly the upper right side of the abdomen. And the gallbladder, which is not indicated, but will be indicated later, is just behind this part of the liver here. So this is another diagram that I did of kind of a crude diagram, but this shows the liver, which is right and left lobes, and there are ducts or tubes. Duct is a tube that drains bile from the liver. These are called hepatic, meaning liver ducts, and they run into this structure here, which is the common bile duct, and it runs down through the this is the pancreas here. This is the head of the pancreas. This is the tail of the pancreas, and it joins with the pancreatic duct. This structure here is the pancreatic duct, and it enters into the duodenum, so that the bile, which is formed in the liver, goes through the common bile duct and enters into the gut, and it facilitates digestion of various foodstuffs. And we see the duodenum and jejunum, and the rest of the gut is not shown. Now this structure here then is the gallbladder, and the tube that connects the gallbladder to the common bile duct is called the cystic duct, this structure here, okay? So that this is the gallbladder, which bile coming down here is temporarily stored in the gallbladder and concentrated in the gallbladder, and then when we eat a meal, there are signals sent that make the gallbladder contract, and it empties its bile into the common bile duct, and that flows eventually into the duodenum. So this is the stomach. You can see that the stomach is near to the liver. The pancreas surrounds the head of the common bile duct. In fact, as we'll see, if you have a cancer of the head of the pancreas, this part of the pancreas, it can block the common bile duct, and that means that bile will not pass into the duodenum. It will back up into the liver and into the blood, and this is one cause of a condition that we'll be describing, jaundice. Okay? So this is a simplified representation of the anatomy of the liver and of the biliary system, the hepatic ducts, the common bile duct, the gallbladder with the cystic duct, and then entering into the duodenum. Probably many of you are at least partially familiar with this already. Then if we looked at the liver under a microscope, we would see that it is made up of lobules, thousands and thousands of lobules, and these little structures are liver cells, and in the middle of a lobule is a central vein which blood drains into the a big vein called the vena cava, and then up into the lungs and into the heart, okay? And in the corner of each lobule, there are three structures. There's a little branch of the hepatic artery, a little branch of the portal vein, which is the vein that brings blood from the gut into the liver, okay? And then there's also a little bile duct. So we call that a triad, 3 structures. One is a branch of the hepatic artery, one is a branch of the portal vein, one is a bile duct, and eventually the blood leaves the liver through this central vein. So it's a different structure from the portal vein. The portal vein is bringing nutrients from the intestine that have been absorbed to the liver, where the liver uses it for a whole variety of purposes. Okay? So this is a liver cell, okay, one of millions and millions of cells in the liver, and it has the usual structures. This is the surface membrane or plasma membrane, and there are protrusions here which we call microvilli. On the surface, when bile is formed in a liver cell, it passes into these little structures called canaliculus. The plural is canaliculi, and the canaliculi drain into the ducts that I talked about before, the hepatic ducts. So here we see the nucleus with the DNA and the instructions, the genetic instructions, okay. Here we see the rough endoplasmic reticulum. These little structures are ribosomes, okay, attached to the membrane of the endoplasmic reticulum. This is smooth endoplasmic reticulum that contains many enzymes involved in the metabolism of drugs. The liver is particularly important in the metabolism of the drugs that some of us may be taking. And then we see the Golgi apparatus. Some of you know that this is the site of enzymes that add sugars onto molecules such as glycoproteins and glycolipids. Here we see the powerhouse of the cell, the mitochondria, the major providers of energy for cellular functions. And over here we have structures called lysosomes, which are mainly involved in breaking down cellular molecules such as proteins and nucleic acids. So this is a liver cell known as a hepatocyte, and the liver has millions and millions of these cells. And let me just go on. So the liver is a very important structure in terms of metabolism. It is, in fact, the metabolic capital of the body, as we'll come to in a minute. Okay? So the liver plays many crucial roles in metabolism. It's involved in the metabolism of proteins, okay, of carbohydrates and fats coming from the gut after absorption, of certain vitamins, for example, vitamin D, which many of us know now is there's been tremendous interest in this vitamin in the past few years. Seems to have many important functions. Certain hormones are metabolized in the liver, for example, steroids, and it secretes bile into the bile ducts and ultimately into the gut. Now, the liver handles the excretion of a compound called bilirubin into the bile. If bilirubin accumulates in the blood for whatever reason, that is the basic cause of jaundice. When we develop a yellow coloration of the skin and of the whites of the eyes, okay, the cause of jaundice is the accumulation of bilirubin in the blood for a variety of reasons that I shall discuss subsequently. Now, bilirubin, you may or may not know, is derived from the breakdown of a part of hemoglobin. Hemoglobin contains heme, which is an organic structure, and globin, which is a protein. So it's the breakdown of heme that provides bilirubin. And red blood cells, which contain the hemoglobin, they only have a life in the circulation of about 120 days, and then they're broken down. So every day, many red cells are being broken down, and normal amounts of bilirubin are being produced. They pass through the liver and get excreted in the bile, and normally they don't cause jaundice because they don't accumulate. But if for any reason the bilirubin accumulates in the blood, that will cause jaundice. So jaundice is a sign of a number of conditions. We'll come back to that. The liver also makes acids, organic acids called bile acids, which are important in fat digestion and absorption in the gut. And there's also a method of disposing of cholesterol via the bile. The liver secretes cholesterol into the bile, and that passes into the gut, and it's excreted. So it's an important component of the way cholesterol is handled in the body. Now, the liver plays an important role in detoxification, and this refers to the excretion of many drugs and also other potentially toxic compounds. So the liver really is a major organ in the way that we handle drugs. Many drugs are changed to inactive molecules in the liver and then excreted into the bile. So overall, the liver is the metabolic capital of the body, and it's a much underappreciated organ. It's the metabolic capital. Usually it does a very good job. It seems to be more efficient than, let's say, Washington or Ottawa or Moscow or Tokyo. Usually the liver is doing tremendous work for us. It's involved in thousands of different reactions in the body. So metabolism, just to make sure that we're on the same wavelength here, is the sum total of chemical reactions in the body, thousands of different reactions. Some involve breakdown of molecules to simpler molecules and also energy, okay, and others involve the synthesis of molecules such as proteins, fats, nucleic acids. And almost all reactions in the body are controlled by enzymes. So there are thousands of different enzymes in our body controlling metabolism. Okay, so just to say a few words briefly about the role of the liver in protein and amino acid metabolism. As you know, proteins are made up of amino acids. There's 20 different amino acids making up our proteins. When we take in dietary proteins, amino acids are obtained by their digestion, okay, and they pass to the liver via the portal vein system, and they're used by liver cells to make various products, okay? And the liver, in fact, takes up amino acids from the blood passing through it, and it can use them to make new proteins and also proteins that it secretes or exports into the blood, okay? The liver is also involved in the breakdown of amino acids, and the end product of breakdown of amino acids is a compound called urea. And urea is made by enzymes in the liver, then it is secreted into blood and passes to the kidneys for excretion, okay? So urea used to be, if there's kidney damage, urea will accumulate in the blood, and it used to be commonly used as a test of kidney function, although it's actually made in the liver, but it's excreted by the kidneys. Now, the liver secretes many proteins into the blood. These hepatocytes that I show you make many different proteins, such as albumin, that's a protein in our blood, various hundreds of different proteins called globulins, and these have a variety of important functions in the body that I won't discuss tonight in any detail. But one important example is most of the coagulation factors that are involved in blood clotting are made by liver cells and secreted into the blood. So if your liver is sick, you may experience serious bleeding because the liver cells are sick and not making these proteins called coagulation factors, so your blood does not clot properly. Okay? Now the liver, so the liver is involved in amino acid and protein metabolism, but it also plays a key role in the metabolism of carbohydrates, of sugars. And in particular, it plays a central role in controlling the level of blood glucose, which, as we know, is pretty important. If your blood glucose falls to a low level, you get hypoglycemia and you can go into coma. On the other hand, if it accumulates, as in diabetes, you can go into hyperglycemic coma. And without going into detail, insulin and other hormones such as glucagon and a variety of other hormones regulate this overall process of keeping our blood glucose within normal limits. So here, the liver plays, again, a central role in controlling blood glucose. Now, the liver can also synthesize certain other simple sugars from glucose, okay, although we can get them from the diet too, such as fucose, galactose, and mannose. And as some of you know, these are used to build up the sugar chains of molecules such as glycoproteins, many of which are secreted into the blood by liver cells. The liver cell builds up the glycoprotein, then it secretes it into the blood, and it has various purposes or functions in the blood. Okay? Now, the liver also plays an important role in fat metabolism. Okay? The liver synthesizes fats, which are called triglycerides, okay, and secretes them into the blood bound to proteins, which are called lipoproteins. Lipo meaning fat, okay, basically. And you all will have heard of, as I'll mention in a minute, low-density lipoprotein, LDL, and HDL. The liver plays a central role in the metabolism of cholesterol, okay. It makes and secretes cholesterol into the blood as low-density lipoprotein, LDL, sometimes called bad cholesterol, which travels through the tissues, and if it travels and accumulates in arteries, this is a cause of atherosclerosis. On the other hand, the liver takes up high-density lipoprotein, HDL, sometimes called good cholesterol. HDL picks up cholesterol in the tissues and sends it to the liver via the blood. Now, I should stress that the cholesterol in LDL and in HDL is the same cholesterol. There's not different forms of cholesterol. Just in this case, the protein which it's bound to is a different protein from the protein involved in HDL. But it's the same cholesterol, okay? Now, the liver, enzymes in the liver, when the HDL comes back, brings its cholesterol back to the liver, some of that cholesterol is converted to these compounds I call bile acids, which are secreted into the bile and are used in the digestion of fats in the gut. Okay, and the liver also secretes cholesterol itself into the gut via the bile ducts, thus helping to get rid of it. So lipid, as I mentioned up here, is in fact the general name for all fatty molecules, including fats, cholesterol, other lipids called phospholipids that contain phosphate, steroids such as various hormones, and other molecules. So lipid is an all-encompassing name that includes fats are one type of lipid. Okay, so then we come to the question, what is bile? You've probably all heard of bile, okay? So what is bile? Well, bile is a fluid secreted by liver cells. This is the approximate amount in a day into the bile ducts, which I showed you earlier, which then passes into the intestines. So the fluid is secreted into by liver cells into the bile ducts and passes down the common bile duct into the gallbladder temporarily, but then out of the gallbladder back into the common bile duct and then down into the gut. So what is bile composed of? It's principally water, okay, but it also contains various ions such as sodium and potassium, small amounts of various proteins, the bile acids that I mentioned that are important in fat digestion in the gut, getting rid of cholesterol, some other lipids as well, the compound that I mentioned previously, bilirubin, the cause of accumulation, the cause of jaundice, and many compounds that are excreted by the liver, such as products of drug metabolism. When a drug is taken in, it's often converted to an inactive product and excreted by the liver into the bile. So the bile acids help in digestion and absorption of fats in the intestine. If the bile duct is blocked, the bile acids will not get into the intestine, and you'll have faulty digestion and absorption of fats. As I said, cholesterol is excreted into the gut, at least some of it. Bilirubin is the waste product derived from the breakdown of hemoglobin from the heme part of hemoglobin, and compounds derived from bilirubin confer the characteristic color of our stools. If bilirubin does not get into the gut, then our stools will be a pale whitish color, and that can sometimes happen in certain diseases. Okay, so a large variety of drugs, hormones, and other compounds pass from the bile into the gut and are excreted in the feces. If the common bile duct, I showed you that structure previously, is obstructed, for example, by a stone, a gallstone getting into the common bile duct, or by cancer of the head of the pancreas, bilirubin and the other compounds in bile are not excreted and they accumulate. And accumulation of bilirubin in the blood is the cause of jaundice. Okay, so I showed you a rather superficial drawing of the gallbladder and the bile ducts. What is the function of the gallbladder? Well, the main function of the gallbladder is to concentrate bile by absorption of water. As much as 90% of the water that is in the bile is absorbed in the gallbladder. So the gallbladder acts as a storage site for bile in between meals. The bile ducts transport bile from the liver and gallbladder into the small intestine, the duodenum. Now, the presence of fatty acids and amino acids in the gut after a meal, they're produced by breakdown of fats and proteins. After a meal causes release of a hormone called cholecystokinin, or CCK for short, that stimulates the gallbladder to contract and release its bile into the common bile duct and then into the gut, aiding digestion and absorption. However, even if your gallbladder has been removed in a procedure called cholecystectomy, that is the operation in which the gallbladder is removed, for example, if it's inflamed or contains many gallstones, the bile from the liver is usually sufficient to maintain normal digestive function in most cases, although some individuals have problems with fatty meals. So if your gallbladder is removed, the common bile duct is still intact, and the bile goes straight from the liver down into the duodenum. It's not stored in the gallbladder. Now, the gallbladder can become inflamed. If it's an acute or sudden inflammation, that's called acute cholecystitis. Cholecystitis is inflammation of the gallbladder. On the other hand, people can suffer from long-standing or chronic inflammation of the gallbladder, which is called chronic cholecystitis. And very often, these people develop gallstones, which are, again, lithiasis means stones, and these are gallstones, okay? So the liver can suffer from inflammation, gallstones, and also there can be cancer can develop in the gallbladder. It's not terribly common. On the other hand, it does occur with some frequency. Okay. Now the bile ducts themselves, okay, not the gallbladder, but the bile ducts that I showed you, they can become inflamed, and this is the name cholangitis, that is inflammation of the bile ducts. Now, stones that come out of the gallbladder, if there are stones in the gallbladder, sometimes the gallbladder expels them into the cystic duct, and they pass into the common bile duct, and they may wedge in the common bile duct and obstruct it, causing jaundice, okay? And very occasionally, you can have cancer of a bile duct, and there's certain other conditions that affect the bile duct. So you've got various conditions affecting the liver, various conditions affecting the gallbladder, and other conditions can affect the bile ducts themselves, okay? So some of the risk factors for liver and biliary tract disease. For liver disease, alcohol is definitely a major risk factor. Certain drugs, certain toxic chemicals can damage the liver. If you're working in a plant where you're exposed to toxic chemicals, some of them can be what we call hepatotoxic. That means they damage the liver. Liver toxic, damage the liver. Certain herbals can damage the liver, so you have to be careful if you're taking herbals. Okay, drinking contaminated water can contain molecules that are compounds that can damage the liver. We don't want to encourage at all the use of recreational drugs. They can damage the liver. Okay, tattooing. If the practices are not hygienic, you can get viruses from tattooing that affect the liver. A family history of liver disease is a risk factor, and a poor diet will predispose you to liver problems. In terms of risk factors for biliary tract disease, obesity is one factor. Repeated pregnancies seem to predispose to gallbladder problems. Increasing age, gallbladder problems are commoner among certain ethnic groups, and again, a family history. Okay.
Dr.
Yes,
Murray?
sir.
Dr. Murray?
Yes.
Sorry, before you leave that slide, could we go back to that slide briefly? There's a couple of questions I want to bring up. Could you give specific examples of herbals and ethnicity, for instance, that are
I don't have a comprehensive list here at the present time. That's a good question, but you really, if you're taking herbals, I think the onus is on you to check out in an authoritative source of various herbals that there are a list of them. I don't have them right handy at the present time, but it's a well-known fact that certain herbals can be toxic to the liver. But I can't give you a list right at this time, but you can't assume that herbals are necessarily free of toxins. It depends on the way they're produced, harvested, etc.
Right. Okay, how about ethnicity?
How about what?
Ethnicity.
Yeah, I think in certain, for example, among the black population, gallbladder disease is somewhat more frequent. Okay.
Okay.
That would be one example.
Okay.
Yeah.
We seem to be hit by quite a few things.
Well, I'm sure there's other benefits too. Look at some of the athletes; they seem to be very superior.
Yeah.
So,
yeah.
I don't want to make any expressive comments about any group, whether it be Scots or Irish or any other group.
Okay.
If I'm telling any jokes at all these days, you have to be so careful. So the only jokes I ever tell are Scottish jokes because I'm Scottish. Okay, so we'll leave that, I think. Okay, so how do you know, or what might make you think that you have liver disease? Well, the signs and symptoms of early liver disease are often quite vague. They're nonspecific. For example, a feeling of tiredness, loss of appetite, loss of weight, fever, upper abdominal pain. Okay, more specific signs are an enlarged liver, which if you feel the liver down below the edge of the rib cage, then you may have an enlarged liver, but you'd want to see a healthcare provider to check that out. Now, jaundice, okay, can be a sign, an important sign of liver disease, but it can also be caused by excessive breakdown of red cells because, as I said before, bilirubin is coming from the heme part of hemoglobin, which is the molecule in red cells, so that in certain cases, types of anemia where there's excess breakdown of red cells, for example, there are anemias called hemolytic anemias, which are due to breakdown and rapid breakdown of red cells. Instead of the red cells lasting 120 days, in some of these disorders they can last 10 days or even just 1 day, even if there's excessive hemolysis. So in these conditions, you're going to get excessive breakdown of the heme, and this is going to produce relatively large amounts of bilirubin that the liver cannot handle, okay? Now, another sign of liver disease might be fatty stools, okay, because bile is not getting into the intestines to aid fat digestion. So the first signs and symptoms were nonspecific. These are more specific, okay? Chronic liver disease, okay, if you have, say, chronic hepatitis, this can cause a number of serious complications such as bleeding in the gut, okay, mainly in the esophagus or the stomach, relative high blood pressure in the portal venous system that I mentioned briefly. Okay, this is not typical high blood pressure. This is in the portal venous system, but that predisposes to bleeding in the gut, okay? The high blood pressure in the portal veins that bring blood to the liver from the intestine, okay? Now, very severe liver disease, for example, severe inflammation of the liver, hepatitis, or severe cirrhosis, which I'll mention in a minute. That is when the liver is replaced by fibrous tissue. You no longer have healthy liver cells. You've replaced much of the liver by fibrous tissue, and that fibrous tissue cannot do the job that normal liver cells can do. So this can cause liver failure, okay, when the liver is barely functioning, and this is a very serious medical emergency, often shown by severe jaundice, okay, possible coma because the liver is not getting rid of various molecules that it normally handles, hemorrhage into the gut, and other problems, okay? So these are the kinds of spectrum of signs and symptoms that you can get in liver disease. Okay, so just to go back to bilirubin, because it is a central component of jaundice, red blood cells contain hemoglobin. Hemoglobin is made up of globin, which is a protein made up of 20 amino acids that we don't have to worry about tonight. But the other part is heme, and then when hemoglobin is broken down, the heme is broken down to bilirubin, and the other component of heme is iron, and that iron is reused by the body. Iron is an important part of hemoglobin, and it's contained in heme, and the heme part is changed slightly to bilirubin, which is excreted, okay? Now, the red cells, as I mentioned, normally last 120 days and are then broken down in the spleen and other sites, okay? So jaundice occurs when there's excessive breakdown of red cells, okay? That can be in a hemolytic anemia, or when the excretion of bilirubin by the liver and bile ducts into the intestine is obstructed. So jaundice in itself is not one disease. It's a manifestation of a number of diseases, for example, anemias, or it can be liver diseases where the liver cells are not functioning and are not excreting the bilirubin, or it can be due to obstruction of the bile system. And I have a figure to show that. Okay, so here this is a blood vessel, okay? So we talk of hemolytic anemias where there's excessive breakdown and formation of bilirubin as being a prehepatic cause of jaundice. That is, it occurs before the liver because the blood is bringing the bilirubin to the liver. Okay, so the hemolytic anemia is talked of as being a prehepatic cause of jaundice. Okay, then we have, if the liver function is disturbed, okay, then bilirubin will not be secreted by the hepatocytes into the bile duct, and this can occur in diseases such as hepatitis or in cancer of the liver. If much of the liver is taken over by cancer cells, then the liver cells are going to be displaced and not function properly. Then we have what we call post-hepatic causes. This is in the biliary system after the liver, okay? For example, a stone can come from the gallbladder, not shown here, and wedge in the common bile duct. The bile cannot get through, so the bile backflows up through the liver into the blood, and we see jaundice, okay? If you have a cancer of the head of the pancreas, okay, that can obstruct the common bile duct. Again, bile will reflux back up the biliary system through the liver into the blood. So there's a variety of causes of jaundice. Some are occurring before the liver due to breakdown of red cells, anemias. Some are due to liver disease, the commonest being hepatitis and cancer, and some are occurring due to problems in the biliary system, and the two most common are gallstones, okay, and pancreatic cancer. Now, a cancer of the tail of the pancreas would not obstruct the bile duct as early as would a cancer of the head of the pancreas. So cancer of the pancreas is a very serious disorder, but if you have it in the head of the pancreas, you're perhaps more likely to go to a doctor because you'll be jaundiced early, and that may be a good thing of getting to a surgeon early on to operate, whereas if it's in the tail of the pancreas, you won't get jaundice early because it doesn't obstruct the biliary system. Okay? So just to summarize then, what is jaundice? Okay? And I'm stressing jaundice because it is a major sign of liver disease. It's a yellow discoloration of the skin and whites of the eyes, which are called sclerae, due to accumulation of bilirubin in the blood. And bilirubin is a yellow pigment derived from the enzyme breakdown of the heme part of hemoglobin. Globin is a protein. It's the heme part that gives rise to bilirubin. When red blood cells age, they are broken down and their hemoglobin is digested by enzymes. Excess premature breakdown of red cells, hemolysis, occurs in certain diseases called hemolytic anemias. And as I indicated, there are many causes of jaundice which fall under the following headings: excess breakdown of red cells, liver disease, for example, hepatitis, obstruction of small or large bile ducts, for example, by liver disease. Inflammation of liver cells can cause obstruction of the small ducts, okay? The large ducts can be obstructed by a stone in the common bile duct or cancer of the head of the pancreas, and some other conditions that I won't mention tonight, which are less common. So jaundice is not a disease in itself. It's an indicator of a problem in the blood, okay, or in the liver, or in the biliary system, and always has a cause that must be sought out, okay? It must be investigated until the cause of jaundice is determined, okay? So what tests do we have for liver problems? Well, the good news is that there's a whole variety of tests that are useful in helping to sort out what kind of liver problem an individual may have. There's a battery of blood tests done on blood is available to help determine the cause of a liver problem. For example, measurements of various enzymes in the blood can indicate liver disease. If you have jaundice, the amount of bilirubin is elevated, so your healthcare worker will send you for measurements of various enzymes to the lab, your blood to the lab, To measure bilirubin, that's a specific indicator of jaundice. Various proteins that are made by the liver can change in amount in liver diseases. A measure of blood coagulation is the prothrombin time. As I mentioned earlier, if your liver is diseased, it will not be making the clotting factors normally, and the prothrombin time will be elevated. Your blood will not clot normally. It will take longer to clot, or depending on the specific test being used. Then there are antibodies that are present in the blood. If you have a viral cause of hepatitis, each virus produces specific antibodies and gives rise to the production of specific antibodies in the body. And there are also other molecules that can be used. These tests all reflect abnormalities of liver function due to various diseases. In some cases, a liver biopsy may be considered necessary. It's not a routine test because a biopsy of the liver can have slight dangers, so it's done if the diagnosis usually is not clear. And then there's a variety of imaging tests that are also available. Ultrasound, for example, is very good for picking up gallstones, CT scans, plain x-rays of the abdomen, MRI, and others. These are all called imaging tests. And then examination of the stools and urine are often useful. For example, the stools are pale if bilirubin is not getting into the intestines because of obstruction, and the urine is often dark if there is bilirubin in it. So it's always, if you notice a change of color of your stools or urine, that might be a sign of liver disease. But there are significant changes in normal conditions too, so don't be too alarmed. Can we get rid of that site panel? It's showing. Okay, sorry. Okay, what are some diseases of the liver? Okay, well, hepatitis is one that we've all heard of. There are various types, mainly due to different viruses. Okay, you can have other causes of hepatitis not due to virus, because hepatitis just means inflammation of the liver. But the most serious group are due to various viruses. Then we can have fatty liver, which is sometimes or quite often associated with taking excess alcohol. Then we have alcoholic liver disease. If you're taking excessive alcohol over quite a period of time, this will damage the liver and you have alcoholic liver disease. And then if you've really been a chronic alcoholic, then you can develop cirrhosis of the liver, which is the liver cells die and are replaced by cells, that fibrous tissue cells that make collagen, or they're called fibroblasts, and they make collagen. So instead of normal liver cells, if you look at a section of the liver from a patient with cirrhosis, then they would have a huge diminution of the number of liver cells, and they would be replaced by fibrous tissue. So these form a spectrum of diseases, okay, fatty liver, alcoholic liver disease, cirrhosis, due to excess alcohol intake. Now there are other causes of fatty liver and of cirrhosis itself, but the commonest causes are excessive alcohol intake. Fatty liver and cirrhosis can have other causes. Okay, then we have cancer. Okay, primary and secondary cancer. Primary is when the cancer starts in the liver. This is not that common in North America, but does occur, for example, in parts of Africa and other parts of the world. And then we can have cancer secondary, coming from the colon as a common site, or the breast or the lung, and the cancer metastases grow in the liver. So primary is when the cancer originates in the liver, and secondary is when it originates elsewhere. and these are probably the three most common sites. Then we can have drug damage to the liver. For example, if you're taking acetaminophen, which is the constituent of Tylenol, if you're taking excessive amount, I've heard 12 capsules a day, but that's just an approximate figure. That can cause severe liver damage in some cases, okay? And there's a whole variety of other toxins and chemicals that can induce liver damage, okay? There are also certain genetic disorders that affect the liver. One is hemochromatosis, which is accumulation of iron in the liver, okay? We won't go into quite a common genetic disease, one of the most common genetic diseases in North America, and it's due to faulty metabolism of iron in the body, and it accumulates in liver cells and damages them. And there's another condition in which a plasma protein called alpha-1 antitrypsin is deficient because of mutations in the gene, and this can cause liver damage. But we will not discuss them tonight. And there are many others that I will not mention tonight. For example, depending on the part of the world you're in, various bacteria and other parasites can affect the liver. And then there's conditions in which antibodies are formed in the body and damage the liver. These are called autoimmune diseases, autoimmune hepatitis, due to abnormal production of antibodies that damage liver cells. Okay, so these are just some of the major conditions of affecting the liver. I'm having trouble getting the next slide here. David, can you hear me? David?
I can hear you, Doc. I can hear you, Doc. If you would right-click try right-clicking again and seeing if that works.
Okay, yeah. Okay, yeah, you're right. Yeah, thank you. Thank you. Yep. Okay. So this is just some brief information on various types of viral hepatitis, because this is by far the most common cause of liver inflammation, infection by different viruses. And there's at least 5 types, more recognized. I've only mentioned 5 here: A, B, C, D, E, and E. Okay, this indicates how they're transmitted. This is fecal-oral route, blood, needles. If you're a drug user, okay, this is again needles. This can be contaminated water. Okay, now types B and C and D can become chronic, which is not good. In other words, this type causes acute hepatitis, usually recovery, but in these 3 particular types, they can become chronic, leading to ongoing disease of the liver. Then these 3 can also predispose to liver cancer, okay, B, C, and D. Regarding frequency of the types of hepatitis, A is the most frequent. This is the second most. This is quite frequent. This is rare, and this is rare in the West, but quite common in the Orient. And there are vaccines available for hepatitis virus types A and B. So there's at least 5 known types, as I indicated, probably many others. Blood tests in which you'd mainly test for antibodies to each, because each of the viruses produces different antibodies in the blood, okay? 3 types can dispose to liver cancer, and in fact, chronic infection with hepatitis C is now becoming a common cause of liver cancer, okay? So hepatitis C is quite a serious condition which you need to have treated as best as possible. Vaccines, as I said, are available. Be careful when you travel. If you're traveling, check out the the area that you're going to so that you know the frequency of various diseases in it, and in this case particularly these types of hepatitis. There's no specific treatment in general for acute hepatitis, okay? Avoid alcohol because that damages the liver further, and eating a low-protein diet are part of the treatment because a high-protein diet puts a load on the liver to metabolize all the amino acids. In some cases of chronic hepatitis, there are drugs, interferon or other new drugs are useful, okay? And after you've had hepatitis, you can feel low, tired, apathetic, etc. for a long time after an attack of acute hepatitis. Okay, so I'm just going to say a few words about fatty liver, alcoholic hepatitis, and cirrhosis. And these three conditions form a spectrum of conditions due to excess intake of alcohol, okay? Fatty liver is the mildest, and cirrhosis is the most severe. The damage that alcohol causes to the liver depends on, obviously, on the quantity consumed, the duration of intake, your nutritional status, okay, and various genetic and metabolic factors. As little as 20 to 60 grams a day, women appear more susceptible than men. Taken over years can cause liver damage, and 60 grams a day, it's been calculated, for 2 to 4 weeks can cause fatty liver. Alcohol is metabolized by enzymes in the body. Most of the enzymes are in the liver to a molecule called acetaldehyde, and this is a very reactive molecule, and some of the damage to the liver caused by alcohol is due to the formation of this molecule, which can interact with proteins and nucleic acids in the liver and damage them. But other factors are also involved in alcohol, the damage caused by alcohol. Alcohol interferes with fat metabolism without going into the details and causes it to accumulate in the liver, being one cause of fatty liver. Alcoholic hepatitis is more serious than fatty liver, and it's a combination of fatty liver, inflammation, and death of some liver cells. Okay? So further than cirrhosis is advanced liver disease with much fibrous tissue, which the cells that the fibroblasts synthesize collagen. The collagen replaces liver cells that have died due to excess alcohol, thus the liver no longer functions as well. Lab tests, imaging tests, and biopsy can confirm the three conditions. Liver biopsy, as I said, is not a routine test, okay, but can be done. Now, liver cells can regenerate, okay, so if you stop alcohol early, you can recover, okay, but fibrosis and cirrhosis are irreversible changes. The classic example of liver regeneration is the Greek myth Prometheus, okay. Prometheus angered Zeus, who ordered him to be bound to a stake on Mount Caucasus, where an eagle pecked out his liver. But because he was immortal, Prometheus could not die, and his liver was renewed, that is, regenerated every night for his torture to resume every morning. So that's rather a gory story. Okay, so the essence of treatment for liver disease due to alcohol is immediate, complete abstinence from alcohol. Complete abstinence. No reduction or taking a few drinks. Complete abstinence is required to stop continuing damage. Sound nutrition, a balanced diet with adequate calories, vitamins, minerals, etc. is also vital, as alcoholics are often poorly nourished. They don't eat properly. They take alcohol instead of healthful meals. And severe complications can develop in people with severe cirrhosis of the liver, infections, bleeding, neurologic brain problems, fluid in the abdomen, which is called fasciitis and has to be drained off, and even when it gets very serious coma. These must be treated appropriately as they arise. In very severe cirrhosis, a liver transplant may be the last hope, and this is complicated in some cases by the factor that sometimes recipients of liver transplants resume drinking alcohol after the transplant. Okay, a few words about cancer of the liver. Okay, it can either be primary or secondary from elsewhere. Secondary is more common in North America. The primary can originate de novo, okay, due to environmental influences, chemicals, or follow cirrhosis or hepatitis B and C, as I mentioned. In some parts of the world, chemicals called aflatoxins, that is chemicals from molds that can grow on peanuts and maize, can cause primary liver cancer. I think that was the case in Ghana in Western Africa. A number of years ago, there was an outbreak of cancer due to aflat molds being contaminated by peanuts being contaminated by molds that make these molecules called aflatoxins. I mentioned the secondary sites from which cancer of the liver, and people, if you have a cancer of the liver, these are the main signs and symptoms. There can be a mass in the liver in some cases. There are appropriate tests for diagnosis. And if you have a single tumor, it's possible that a surgeon may be able to remove it. If multiple tumors are present, then you may opt for chemotherapy, but it cannot be removed if both lobes of the liver, the right and left lobe, are both involved. So, okay. Now this is an important topic, drugs in the liver. Many drugs are normally metabolized by enzymes in the liver, and their inactive products are excreted in the bile into the intestine. Now liver disease can affect the metabolism of drugs. If you have hepatitis, the liver cells are sick, so they're not going to metabolize drugs normally, and this can change the effects of drugs. For example, certain drugs given to patients with cirrhosis may be much more potent than usual because the liver cells are not there. Normal liver cells are not there in sufficient amount to get rid of the products of metabolism. If you have a liver problem and are on drugs, consult your healthcare professional and your pharmacist about the drugs that you're taking. Many drugs and herbal preparations can cause liver damage. There's wide variation in toxicity. Some are relatively frequently toxic and others are seldom toxic. And the toxicity may cause death of liver cells, impair the secretion of bile into the bile ducts. This is called cholestasis. Stasis, the bile is not secreted normally, and chole bile, or unusual reactions can occur to drugs, or even in some cases they can cause chronic liver disease. And these are some of the drugs that can are frequently toxic: acetaminophen, iron itself, isoniazide, which is used for treatment of TB, methotrexate, which is quite commonly used for rheumatoid arthritis or cancer. But there's a whole list of various drugs, and treatment generally consists of withdrawing the drug and giving supportive treatment. So be informed about any drugs that you're taking. If you go to the pharmacist, get a list of side effects of the drug and ask questions of your pharmacist or your healthcare provider about the drugs. Okay, so briefly then, some signs and symptoms of gallbladder and bile duct disease. Common symptoms are intermittent upper abdominal pain, often in the right side, intolerance of fatty foods because of improper digestion. However, low-grade inflammation of the gallbladder and stones in the gallbladder may be silent, not causing any signs or symptoms. Presence of stones in the gallbladder or bile ducts can cause biliary colic. That is when a stone gets out of the gallbladder into the bile duct, it doesn't necessarily totally obstruct it, but it causes the bile ducts to contract on the stone, and this can cause biliary colic, which is severe upper abdominal pain. It's something like having a kidney stone in your ureter. It can be very severe colic called biliary colic because the bile ducts our gallbladder in some cases are contracting on the stones. And stones can be detected with high success by abdominal ultrasound, okay, and there's other imaging tests. I know that I had an ultrasound a couple of years ago for another slight problem, and I was surprised to see they visualized my gallbladder, and I could see a stone rolling around inside the gallbladder. I assume it's still there. Okay, so some diseases of the gallbladder and biliary tract: inflammation of the gallbladder, acute, which is called cholecystitis, and it may be acute or chronic, that is sudden onset or ongoing, continuing over a long period of time. Stones in the gallbladder, that's called cholelithiasis, means stones, okay, made of cholesterol, and the stones are made of cholesterol usually, or bilirubin, or they may be mixed, a mixture of cholesterol and bilirubin, okay? I know my wife had her gallbladder removed, and there were about 60 stones in the gallbladder, and we kept them in the house for about 5 years in a little glass jar, okay? So these are often associated with inflammation of the gallbladder, the presence of stones in the gallbladder. As I mentioned, biliary colic, stones impact in the cystic duct because it's narrower than the common bile duct, so a small stone can impact there and cause contractions of the duct, and that causes severe biliary colic. And a stone may pass into the common bile duct, block it, and prevent excretion of bilirubin, causing jaundice. Cancer of the gallbladder does occur, okay? Inflammation of the bile ducts, and occasional cancer of the common bile duct can also occur. So there are appropriate treatments for each of these conditions. Acute cholecystitis, usually antibiotics, and laparoscopic removal of the gallbladder are indicated. Laparoscopy is now much preferred over open surgery. It's been perfected. Okay, chronic inflammation of the gallbladder, usually again laparoscopic removal of the gallbladder is indicated. Stones in the gallbladder, if they're causing symptoms or complications, then usually removal of the gallbladder is indicated. Sometimes they can be treated medically by drugs that help to dissolve them, but the stones often recur. And stones obstructing the common bile duct should be removed surgically. Cancer of the gallbladder, depending on the stage, surgery may be indicated, or in some cases, a bypass procedure is performed. And inflammation of the bile ducts, antibiotics, and surgical removal of any stone that is, say, predisposing to inflammation of the bile ducts is undertaken. Okay, so finally then, we've seen that there's a variety of conditions affecting the liver, the gallbladder, and the bile ducts, okay? Jaundice is an important sign of liver disease and of obstruction of the bile ducts by gallstones or cancer of the pancreas, okay? And viral hepatitis is certainly a very serious problem. It's increased greatly because of drug usage, okay? So what are some measures to help protect your liver and your life? Okay, well, one, of course, is to limit alcohol, and this is facetious, no more than 1 bottle of malt scotch per day. So ignore that remark. The Scottish Liquor Board paid me to say it, Okay. Now, actually, 2 standard-sized drinks per day, and these are defined. You can search out the meaning of a standard-sized drink yourself. Okay, and 1 standard-sized drink per day for females. Okay, none at all if you have liver disease. Okay, don't fool yourself that you can drink alcohol if you have liver disease. Minimize the intakes of therapeutic drugs, okay, because many drugs can be toxic to the liver. So you may be on a life-saving drug, that's fine, but overall, try to keep the number of drugs that you're on to a minimum. And of course, avoid absolutely recreational drugs, particularly by the intravenous route, because this is certainly a major cause of hepatitis. Okay, if you're working in a plant or a chemical plant or in an environment where they're exposed to various chemicals, watch for and inquire about exposure to toxic chemicals at your workplace. You don't want to incur liver damage due to toxic chemicals at your workplace, okay? When traveling, then, if you're traveling, consider vaccines for hepatitis. Avoid local water unless absolutely known to be okay, and uncooked foods, etc. Most listeners probably are aware of all this, for example, salads, and inquire before you go about local hygienic conditions, okay? To keep your liver in good shape, develop sound, healthful nutrition with adequate calories, vitamins, and minerals to keep your liver cells healthy, because after all, they're doing so many important metabolic functions in the body that you want your liver cells to be in first-class shape. Okay, limit or eliminating smoking. For example, smoking can adversely affect alpha-1 antitrypsin deficiency disease, which I mentioned earlier is one genetic type of liver and lung disease. Okay, and I think in most cases there's really no need to be smoking. Okay, now so I'd like to thank you for listening and to stress again that your liver is doing a myriad of important functions for you. So please look after your liver, and thank you for listening.
Thank you very much, Dr. Murray. Once again, this has been a masterful presentation on a very, very important topic. If you have a few minutes, we're going to take some questions, if that's okay with you.
I certainly do. Just don't ask me any more about the herbal medicine.
Well, I want to talk more about the ethnicity thing right now. No, I'm just kidding. Okay, I'm going to transfer it to me really quickly. Folks, remember, you can always click type in your questions. A few people have already done that in the chat box to your right. And while you're getting all that together, I'll be looking through the questions. But before then, I just want to make a quick. I did this earlier, but I recognize there were much fewer people than we have now that are on the call. This is our website. Most of you obviously had to go through the website to register, but there were some things that you probably may have missed, and I just want to just bring that up to you. If you are interested in watching any presentations of the past, you can click on this to the left here where it says Feature Presentations. And there are quite a few, like 6 or 7, I believe, presentations that are there that you can actually click and watch. And really, as I mentioned earlier, there are now programs and things like PlayStation 2, Wii, for instance, Xbox can now, they can go to they can go on the internet, go to the site, and actually play presentations right from your Xbox. So technology is really, really advancing. Please, after the webinar, when you get a chance to, this page will still be open. So click on that, and you can type in your questions. Some people have already typed in comments. If you loved the presentation, go ahead and type it in. If there was a couple of other things that you wanted to clarify, obviously we're not going to be we will not be treating questions that disease specific. But if you have questions about the liver and how it works or what to make it more healthy, sure, we would love to help you take care of some of those questions. And if you don't mind leaving your comments there, that would be great. We always like to be able to see your feedback. And if you want to know what's coming up, there are two ways you can check out the presentations coming up, either by going to the right column, where it says upcoming webinars. These are all Eastern time. And you can just go down the list, and we are constantly compiling and getting presentations from new speakers. And I mean, as word about what we're doing spreads, it keeps getting better and better. Oops, I clicked on the wrong one. But if you ever want to see a list of our presentations, we have a very long list. It really goes down to the bottom of the page, very, very long. But on the left side, you can see the topics the categories of the topics we have covered, everything from the spirit, the mind, the body, how the body works, what the body needs, and each of these have several presentations that treat them. So we try to make it as simple as possible for people, especially those of you who are not too internet savvy. And you can always click on our calendar. You can see at a glance the presentations that have come and gone and what is coming up. This shows the presentations for September, and I mentioned earlier that this is probably the busiest month we have had so far. Usually we have like 4 or 5 a month. Now we're having close to 20 this month. That's keeping Sherry and me very, very, very busy, but it's a good busy. So I want to encourage you to take advantage of this. Obviously, if you want to be a member, membership gives you access to all our close to 150 presentations. You can go in there and you can watch them at your own time, and you can enjoy the presentations there. And all you need to do is, there's a monthly fee. There's no contract involved. If you want to pay for 6 months, you get a good discount. If you want to pay for the whole year, you even get an even better discount. So that said, I'm just going to take it back to our main slide with Dr. Murray, and I'm going to start handling the questions. All right, quite a few have come in. I just want to also mention, too, that the reason why I interjected during Dr. Murray's presentation was that it's important that we know the threats to our health, and it's important that we know where our weaknesses are, so we can help to compensate or build upon our weaknesses. What I've noticed is that in quite a few presentations, like presentations on cardiovascular health, presentations on things like vitamin D, African Americans or people of African descent have a significant disadvantage, and especially when it comes to diabetes, heart disease, and vitamin D deficiency. Well, you can either mope about it or find out what you can do to compensate for that. And I think it's important that we understand what the threats are. And of course, Caucasians have their own issues as well. Skin cancer obviously is one glaring example. You have a lot more skin cancer than people of African descent do. So it's important to know what you can do to improve and strengthen.
Similarly, hemochromatosis and cystic fibrosis are much commoner among North Americans and among blacks. So there's a lot of diseases that are less common among blacks than among whites.
Right. In fact, I don't believe there are people with cystic fibrosis of African descent. Do you know of any? Is that even possible?
I think there are some occasionally, but it's unusual.
Huh.
And it's not the same mutation usually as is most common among North Americans. I think the story for that is that the original people came from Northern Europe to North America, and that's why the disease was mainly among whites. And the same with hemochromatosis. There's some evidence that it came from Scotland, Ireland, and Scandinavia.
Really?
Yeah. They call that the original carrier of the gene.
Mm-hmm. And the thalassemias are mainly from the Middle East, aren't
Mediterranean.
they? Mediterranean,
yeah.
That's right.
Yeah. Also the Far East as well.
Interesting. Quick notes: some detoxification methods. I know Dr. Murray didn't cover that because that's not his his focus, but things like zeolites, we had a presentation on activated zeolites on toxic for pregnancies yesterday, and zeolites can help to detoxify the liver. Obviously not treat issues, but help to reduce the burden upon which under which the liver has to function. So helping any way you can, and of course, like you mentioned, vitamins, fruits and vegetables can also help to reduce the toxic burden that your liver has to function under. All right, quite a few questions. Doc, if there's a question you don't want to address, just say pass. Okay. And please let me know whenever you want to wrap it up for the night, and we'll just wrap it up. Okay. When one has a cholecystectomy, is it important for some kind of liver support through vitamins and minerals? If so, what are some examples?
Well, I would say yes, if you're in general that you want your liver to be as healthy as possible after a cholecystectomy. Okay, although the inflammation of the gallbladder may not directly involve the liver, but in general, I think you're just taking what I would call a healthful diet, and then taking good multivitamin supplement. These days, vitamin D, okay, omega fatty acids. I think all of these are good. There's no specific diet recommended for post-cholecystectomy, as far as I know, other than taking what I would call a healthful diet, a balanced diet, okay, not a fad diet, and probably taking multivitamins and some of the other supplements that are available. Very often people with gallstones, for example, are somewhat overweight, so in general I think it would be good to go on a weight reduction diet if you are overweight. But there's no one, as far as I know, post-cholecystectomy diet per se.
Mm-hmm. Okay. Can you say something about Gilbert's, I guess that's Gilbert's disease, and fatty liver?
Yeah, Gilbert's disease is quite a common condition in which there's mild jaundice, and it's due to mutations in genes controlling enzyme called glucuronyltransferase. Glucuronic acid is a sugar related to glucose, and I didn't mention this, but when bilirubin is formed, say in the spleen, then it passes in the blood, and it passes to the liver, and when it enters a liver cell, the bilirubin is conjugated to glucuronic acid, okay? There's an enzyme hooks the bilirubin onto glucuronic acid, and that makes it more water soluble, so it is easier to excrete into the bile ducts. And Gilbert disease, if you want, I don't think you really call it a disease because it's quite a mild condition. Gilbert syndrome maybe is due to the fact that the enzyme has mutations and is not quite as active as the normal glucuronyltransferase. So these people tend to get mildly jaundiced, but it's not a serious, very serious condition. You could probably check it out further, but I would not be too concerned about it because, in fact, I remember it's mentioned briefly in our textbook, but the coverage there is small compared with coverage in regular textbooks of medicine. It's a well-recognized condition, but it's relatively mild and benign.
How about fatty liver?
Fatty liver, that can be due to poor diet, diets deficient in choline and other conditions. The commonest cause probably is alcohol, but there's a number of other conditions. It can occur in pregnancy too. in some cases it can be a little more serious in pregnancy. So alcohol is not the only cause of fatty liver, but in general, if you have fatty liver, again, stop alcohol, keep drugs to a minimum, and go on to get your diet as nutritious as possible and consider supplements. It might be that you need choline as a possibility, etc. But fatty liver is quite a common condition, and I think that the measures that I indicated there, you should adopt them.
Okay. Here's a good question. What are the side effects of gallbladder removal that one should be concerned about?
Well, sometimes there can be surgical complications that you might not, a bile duct can be injured, etc. There is a syndrome called post-cholecystectomy syndrome, which some people experience. Okay, so there are definite in most cases, the surgery is successful, but there can be complications due to surgery itself. Some people, unfortunately, develop a post-cholecystectomy syndrome, which is, I don't think it's fully understood what the cause of that is, and you might experience some digestive disorder, so you might want to take additional lipase pills to help you digest fatty foods if that's really bothering you. So these are the main ones that I know of. I'm not an active surgeon. Probably your surgeon could, if you've had surgery, could tell you quite a bit more about the any complications that arise after removal of the gallbladder.
Right.
You can function, in many cases you can function perfectly or almost perfectly normally.
That's good to know. Is there a test for a drug like Coumadin to indicate its deleterious effect on the liver, and so indicate when to withdraw consumption of Coumadin? Thank you for your presentation, by Harold.
Yeah, I would say, well, there are genetic variant. There are different people can handle Coumadin differently because of different forms of the enzymes enzyme that metabolizes Coumadin. The main indicator of Coumadin's effectiveness is the prothrombin time, and if you have serious liver disease, okay, and you're already not making as much of the coagulation factors, you'd have to be very careful. Your dose of Coumadin should be lowered, but the best way of following the effectiveness of Coumadin is by, for example, the prothrombin time. But if you're in the unfortunate situation that you have liver disease and you have to take Coumadin, I would think you'd be taking a much smaller dose of Coumadin than would a normal individual. Okay.
Okay.
I don't know if that's a satisfactory answer or not.
Well, he will let us know.
Any genetic tests for Coumadin are still pretty research oriented, as far as I know. They're not commonly performed in local hospitals, apart from the measurements of the blood coagulation factors, which are pretty standard.
Okay. Can you talk briefly about the bacterial peritonitis associated with hepatitis C?
Yeah, that can, I guess your resistance is lower than hepatitis, and it's I don't know how, I don't have figures as to how common bacterial peritonitis is in people with hepatitis. If there's been any reason for, say, taking off fluid from the abdomen, if you have accumulation, sometimes in relatively serious liver disease, you have accumulation of fluid in the abdomen called ascites, E-S-C-I-T-E-S, and that may have to be taken off by a needle. So during that procedure, in some cases, it's possible to develop bacterial peritonitis, that is, bacteria get in and cause inflammation of the peritoneum. That's the lining of the abdomen, and that's you definitely want to get appropriate antibiotics and get that treated as promptly as possible. I'm not sure, to be honest, if you have any of the 5 types of hepatitis, how often bacterial peritonitis accompanies that. If bacterial peritonitis is basically the growth of bacteria inside the abdomen, in the space inside the abdomen, but I don't have figures for off the top of my head for how common bacterial peritonitis is in the various types of hepatitis.
You touched on something which is very important: the immune system and the liver and the healthy liver. How again does the health of the liver affect the effectiveness of the immune system?
Well, there are a lot of macrophages in the liver, which are a basic component of the immune system. Most of the antibodies are made in plasma cells, which are in fact in lymph glands and bone marrow. So that although most of the other plasma proteins are made by liver cells, but the antibodies are mainly made in cells outside the liver. But on the other hand, the macrophages in the liver are certainly an important component of the immune system, and they make molecules such as cytokines that help to regulate the immune system. These are small proteins usually that are almost like hormones, but they affect the activity of the immune system. So in liver disease, that aspect of the immune system will be affected.
All right, and by macrophages in the liver, you're of course referring to the Kupffer cells.
We're talking of Kupffer cells and other cells that have a role in the immune system. But the antibodies are not basically made in the liver. Most of them are made outside the liver in other parts of the immune system, in the plasma cells, etc.
Okay. I know you covered this, but the question comes up again. Obviously, people want to know what they need to do, what foods what are good foods of specific supplements that can be used to support the liver. I know you mentioned the omegas, the vitamins.
You know, I would think a good multivitamin supplement that contains the required amounts of most of the major vitamins. Again, there's more and more attention on vitamin D, okay? Mm-hmm. These days, there's a lot of evidence that many people are taking relatively low amounts of vitamin D. So I think a good balanced diet, not a fad diet where you're taking more or less recommended amounts of protein, carbohydrates, and fats, okay, plus multivitamins, okay. I would recommend omega-3 fatty acids, although I'm not sure that they're specifically indicated in counteracting liver disease, but overall they're certainly very beneficial. If you have liver disease, you want to cut down on protein because the liver won't handle the amino acids. A damaged liver won't handle the amino acids. In some cases, fatty liver can be due to choline deficiency, but you'd probably need a special investigation to make sure of that. So overall, I'm recommending a good, healthy, balanced diet plus the usual vitamins and mineral supplements.
And lots of fruits and vegetables, huh?
Yes. Yeah. Well, these days, I mean, I think a healthful diet is now coming to be. Many people are certainly taking the fruits and vegetables are a major component of a healthful diet. I guess I'm almost assuming that. You know, a lot of people are going vegetarian because of problems with cooking meat, etc. I think one can lead a very healthy life if you're a vegetarian. The only problem, I think, in some cases can be vitamin B12, that it may be scarce. And the liver, again, plays a central role in vitamin B12. In fact, the old treatment for pernicious anemia, which is due to deficiency of B12, was until the isolated B12, the treatment was to eat large amounts of liver each day because it provided B12. The liver, B12 is stored in the liver, and that used to be the treatment that kept people alive before vitamin B12 was isolated and identified. Back in the 1920s, people with pernicious anemia, which is due to B12 deficiency, that was the treatment for the disease, was to eat large amounts of liver.
Interesting.
I still, myself, I like liver and onions, but I don't take it because of B12 deficiency.
Yeah, I like that too. If you are a vegetarian and you're listening to this, just want to mention that spirulina, the algae, has one of the highest amounts of vitamin B12 of any known plant. So if you want to supplement with, if you're concerned about your B12 levels, spirulina is a really good nutrient to supplement with, because it has high, like I said, high levels of vitamin B12, and you can watch a presentation of that on our website. That's for free. That's one of the free presentations. Just click on the feature presentations on the left side. Okay, I'm going to have to wrap this up after these at most 2 questions. Okay, here's a good one. Well, they've all been very good, but here's one that's caught my attention. Some fruits have high fructose levels. What is your opinion of fructose toxicity for the liver?
Yeah, that's an interesting question. There seems to be fructose is handled differently. The enzymes that handle it initially in the liver are a bit different from glucose. The major there are certain genetic diseases, conditions which are fairly uncommon, in which some of the enzymes involved in fructose metabolism may not be working because of mutations in their genes, and that can cause toxic reactions to fructose. The present debate about high fructose syrup, etc., high fructose, seems to be more that it predisposes to obesity, but there's probably other people out there who have strong opinions about fructose. I noticed that the farmers are trying to change the name to a more benevolent, more benign name that doesn't have the connotation that is developing. But I was just reading about this week, and some people are a bit ambivalent, and they feel the major contribution is just that it encourages a low price of food, and already, as we know, a huge number of people in North America are overweight, and the cheap food that is being eating is adding to the total caloric intake. But there's other studies out there, but I don't know how well established the picture is. As I understand it, that's the main argument, but I may be underselling other points that occur to people who are listening.
I've actually heard there are studies that show that high fructose can cause inflammation in the body.
Yeah, there may well be, although so I'm not knocking that. It's something that you really have to check out. It seems to be varying. It's one of these. It's such a hot area that I think the truth is still, the complete truth is still evolving.
Mm-hmm. Mm-hmm. All right, last question.
In general, I would diminish the intake of it. I guess that would be my overall recommendation. Although if there's any farmers in Iowa listening, they might be quite irate at that remark.
We don't want another Oprah on our hands, huh?
Yeah.
Well, Oprah case. I mean, not Oprah, but Oprah case.
Okay.
With the beef farmers, I guess. All right, the last question. I'm a little confused about floating BMs. Do you know what that means, Doc?
What's that?
It's an abbreviation. B and then M. Ball and Mary. That's BMs. Well, I've asked you to tell me what BM means, and I haven't heard back from you, so we're gonna have to skip it.
Yeah, I'm not quite sure I understand the question. I didn't.
Oh,
BM?
okay, bowel movements. Okay, no.
Okay, yeah, some of them can be due to too much fat. If we're talking about the bowel movement floating in the toilet bowl, is that what we're discussing?
Fatty floats.
Yeah, some of them can. Yeah, but I think they can also be in some cases quite benign. The way to check is you can actually have the amount of fat in your feces measured. It's a lab test in which they do quantitative determination of fecal fat. But you can have transient bowel movements that float, and they're not really anything to worry about. But consistently you're getting fatty stools. If you're losing weight, etc., then one investigation might be to measure what they call fecal fat content, and that can be quantified. For example, children with cystic fibrosis, because their pancreas is affected, they do have a relatively high content of fat in the feces.
Mm-hmm. Mm-hmm. All right. That wraps it up for tonight. Doc, thank you for another excellent presentation.
Thank you, and thank any listeners who are still listening, and I wish you all the best of health and keep your liver in good shape.
Absolutely. Well said. All right, folks, thank you for joining us, and we will let you know the upcoming webinars next week, and stay tuned. God bless. Have a good night.
Are we off?
Yes.